Does your thumb lock or click when you're bending or extending your thumb? Or maybe it won't even straighten after bending it. If this is the case, you may want to give this condition a thumbs down, as you may have something called a trigger thumb. In this video, I will explain to you what a trigger thumb is, what are some of the causes, and a couple of exercises that you can do to help yourself. Hey, I'm Mike, physiotherapist from MyPhysioGo. Our channel is inspired by common questions we get asked and questions we see in our practice. We use our clinical experience and evidence-based research to provide you with the knowledge and tools to help improve your physical health. So let's get into it. To understand what a trigger thumb, we must have a look at the anatomy of the thumb. The thumb consists of one metacarpal bone and two phalanxes, one that is proximal, which means closer to your body, and one that is distal, which means it is furthest one away from your body. The thumb is highly mobile and can move in all sorts of different directions. Trigger thumb can be triggered by the tendon's outer sheath, and the pulley system. The tendon that is responsible for the trigger thumb flexes the thumb. They are the flexor pollicis longus and the flexor pollicis brevis. They originate in the forearm area and run down the palmar surface of the thumb. The tendon in its outer sheath runs through three pulleys called the A1, oblique, and A2. The pulley that is most commonly involved in the trigger thumb is the A1 pulley. Next, you have the synovial sheath, which is a structure that surrounds and protects the tendons of the thumb. The synovial fluid provides nutrition and allows for proper gliding of the tendon. The third possible structure that can cause a trigger thumb is the pulley system, as mentioned previously. The pulley acts like a tunnel where the tendon runs through, and the job of the pulley is to keep the tendon close to the joint to effectively transfer force to the bone to generate movement. When these structures are irritated, inflamed, or injured, the space within the pulley is reduced and you end up with a stuck or a trigger thumb, as the tendon cannot glide properly through the pulley. Trigger thumb is seen more commonly in women and generally affects people between the ages of 40 to 60, although it has been presented in people younger than that. Individuals who perform repetitive activities and overuse of the thumb, like gripping and use of vibrating handheld machinery, are more susceptible to trigger thumb. Other medical conditions such as diabetes and rheumatoid arthritis also increases the risk of a trigger thumb. Treatment for trigger thumb depends on the severity, acuity, and how long you've had the trigger thumb. The Connell scale classifies the severity of the trigger thumb from 0 to 4 mentioned here. 0 means normal movement, 1 uneven movement, 2 actively correctable, 3 passively correctable, and 4 fixed deformity. If the trigger thumb is quite acute and presents with pain, swelling, and disability, the general management is the use of anti-inflammatory drugs, icing the thumbs a few times per day for a few minutes, and performing non-aggravating movements. Keep your thumb moving in all directions, making sure you're not reproducing pain or clicking. In the morning, you may get a bit of relief when you soak your hands in warm water. A thumb brace to help keep the thumb being flexed or bent throughout the night can also be beneficial for your recovery. When your trigger thumb has stabilized and there is less swelling and pain, you can start doing some self-friction massage daily on the pulley and the tendon for 2 to 3 minutes per day to loosen up the scar tissue and adhesions that impedes on the smooth gliding motion of the tendon. It may be uncomfortable at first, but as you progress, you may notice that your thumb starts moving a little bit smoother and there will be less catching. Strengthening of the thumb into extension can also help stretch the thumb flexors, and you can do this with a TheraBand or even with a rubber band. Simply wrap the band around your thumb and pull the band into extension. The next exercise is the tendon glide. With this exercise, you want to make sure that your MCP joint is stable and not moving, and move the distal phalanx into flexion and extension to glide the tendon at the MCP region. There should be no pain or clicking when performing this exercise. The most important thing to achieve full recovery from this condition is to minimize the stress and trauma that you're putting on your thumb. You may need to alter the use of your thumb for 3 to 4 weeks, avoiding any activities that involve pressure on the tendon and the pulley system, like repetitive gripping, grasping, or using vibrating machinery. Otherwise, the condition may be slow to improve, become chronic, frustrating yourself and your treatment provider. If all else fails and conservative management has not achieved the desired effect, your doctor may consider a corticosteroid injection into the tendon sheath to decrease inflammation. And if that still doesn't work and is bothersome, surgical release of the pulley is the last resort. I always tell my patients to do everything possible to help manage this condition, because usually with the right amount of discipline and consistency with your routine, practicing proper self-care and avoiding aggravating activities, the trigger thumb resolves over time. Hopefully that you will be able to give this a solid thumbs up and leave your comments and questions below, and I will answer them as soon as I can. Consider subscribing to our channel to see more videos like this, and I will see you next one. Bye for now.